Hello everybody, it's that time of the week again. Overall, in terms of the homes and the performance in the homes, the performance of staff, etc., all very good. We've had no COVID-19 issues, so we've had some issues where had one individual had to go in isolation, but that's all now clear. We've been doing mass testing. We've got a fantastic team, Amy and co, who are going in and are becoming real experts at doing all the testing. I think we're up to about 60 or 70 tests already, and we've got more programmed, which is really good news. And it's also very good news that we're getting quick results back as well. So there's been a lot of criticism of the government, but now we actually want to say, hey, it's going well, and long may it continue to go well. Perhaps I shouldn't have said that because it will probably go badly, but I'm the optimist, so it will continue going well, I'm sure. So basically the home's fine. We are trying to restore activities wherever possible. And I know that some horse riding is now back on the scene, although it's in very sort of very considered, risk assessed, and social distancing all being applied. So it's not like before. The one we're desperate to try and get back on stream is the swimming, and we use a particular pool, and it's a sort of private type pool, and we're hoping that they will soon be able to get all their risk assessments and processes in place. But that will be great, because I think swimming is a terrific one for a lot of people. So that's all very, very positive. The good news was, for our point of view, is operationally that Public Health England have now, through the Department of Health and Social Care, they've actually now published the guidance, the amendments to the guidance, which we were very much instrumental in helping to draft and to push through. That's really helpful, gives us some more flexibility, and I know that operationally we will be looking at situations where individuals are not being able to, are suffering particularly from having to work with staff in PPE. I mean, it's still a very tough process we have to go through, but it's there, and we'll start looking at all of those cases. So that's really good. So we're looking at catching up on all the training. Obviously, we had to cut down training a little bit when we were taking people in and you couldn't have the physical contact to the same degree, but we are now being able to do more bespoke training. So everybody is going to be absolutely up to sort of standard. We're very pleased with the number of staff who we have taken on since sort of the lockdown, who have not had care background before. And we've got some really great people coming through, which is very encouraging. So that's all very good. Unlocking lockdown, obviously that's the big one. And Public Health England did actually say in an email, and I probably said this on one of our COBRA meetings, that they were starting to look at all of this. What we can do is keep pressure on them, and we will, I promise you, keep the pressure on as much as we can, and also through Care England and so on, we'll do that. I do want to thank the large number of incredibly nice emails that we've received since sending out the last communication. I really do appreciate it. I know how hard it is not seeing your sons and daughters, but equally, really do appreciate the really nice comments and the fact that you guys recognize that it is in the interests of your sons and daughters, and the view that you take. I think it's a very unselfish view, which is terrific. We really appreciate all of that. Bit of good news, we're starting to roll out the parent portal. I know that because Anne and I got a portal this afternoon, and we were able to look at Laura's films. We've signed all of the disclosures, or all of the things that we have to sign on privacy, etc. I would encourage all of you that want to have a portal to do that, and then we can start uploading the films. I'm sure there will be hiccups, because there always are. You look at the testing and everything else that happens when you roll something new out and you roll new technology, etc. So there will be hiccups. You might see things that you don't necessarily think are right when you see those films. Don't panic about that. Go back to the managers, whoever it is that you communicate with, and it might be, well, I don't know why she or he was actually wearing, or why were they doing that, and that will be an inevitability of all of this. So please do sort of respond and respond with the staff team and so on, because I think it's really good. I think it's really nice when certainly I've appreciated the extended film on Laura, and it just gives one a little bit of a snippet, because you can get a better feel for how your son or daughter is actually being supported. Okay, well, that's about me done, and I'd like to wish you all a great weekend and catch up with you next week. All the very best. Thank you.